Hi, and welcome to Healthy Living. I'm Dr. Debbie Lanes. I am here with Dr. Kirk Johnson today, and we are comparing stories. We've been talking about horses, which is pretty interesting. I wonder if people know that you are a horse aficionado.
I am and have been for a number of decades. My son was very competitive in the United States in the field of reining, which is sort of Western dressage.
Okay.
We have American quarter horses out in Ridgeland, and yeah, I love taking care of them, and they're part of the family.
I feel a road trip coming on, just saying. You know, that's one of the perks of doing this.
Absolutely. You're welcome anytime.
Exactly. We were talking about what to talk about, and this is Men's Health Month. As we were saying, it's always a something. But I would love to talk about, as we get a little bit older, I hear a lot of people talk about my back hurts, my neck hurts, my shoulder hurts, my hip hurts. Is it arthritis? Is it old age? Is it, which I hate, because even though I am aging, I still feel really good. Things maybe click a little more. But can you talk me through a little bit of, the arthritis?
Neither of us are a little bit older, but we can talk about other people.
Yes, we will. Yes, exactly.
So, yeah, is arthritis inevitable with aging? That's a question that's, I mean, isn't it just about aging if people have aches and pains? And it's actually genetically more, it's more driven by genetics. We can't pick our parents. So there are some people that come to see me at age 40 that have pretty devastating arthritis.
Okay.
And I have people that are in their 90s and even hundreds that are just beginning to have some signs and symptoms of arthritis.
I'm going to go back even further. What is arthritis?
So arthritis is we use the term osteoarthritis, and it refers to thinning of the cartilage in our joints. The cartilage begins to wear or be lost.
Okay.
The cushion between
the
knee, between the femur and the tibia.
Okay.
And people think, well, I have arthritis, excuse me, because I used to work on concrete, or I have arthritis because I ran marathons, and nothing could be further from the truth. We can't really, now, if we're 100 pounds overweight and inactive, that can be an escalation of arthritis that's genetically given, but it's primarily genetics.
Okay.
So it's thinning of the cartilage that results in pain and swelling. And through the early stages of arthritis, the key is don't stop moving. In fact, I have people that come in with, and I tell them they have moderate arthritis. And I say, what do you do for activity? And they say, oh, I'm really active. I take care of my own house and I walk my dog. I said, no, that's not really active. You need to manage your moderate arthritis. You need to be out and about at least 45 minutes of aerobic movement of your knees. What does aerobic mean? It means the exercise that brings your heart rate up. You actually, so if you're walking with a friend and you're carrying on a conversation like I'm having now, you're not walking fast enough. You need to be walking fast enough to maybe have a conversation like that. You're breathing hard. That means your heart rate is up. That means you're exercising your knee or your hip. You're moving the cartilage. You're feeding the cartilage. So can you make arthritis? You are feeding your cartilage. The only tissue in the human body that doesn't have a blood supply is articular cartilage.
What does that mean?
A piece of articular cartilage. The cartilage look at it in the microscope, you won't see a blood vessel. Every other tissue has blood vessels. That's how it gets nourished. Cartilage has to get its nourishment with movement and weight bearing. When I started doing orthopedics back in the 70s, we treated femur fractures in bed. Put a pin through the leg, put traction over the end of the bed, and these people were in the hospital for 2-3 months.
Oh my God, okay.
The femur healed fine, but the knee and the hip died. The cartilage, we created arthritis by being people that had bed rest.
Oh.
Yeah. So bed rest was a treatment for a lot of pulmonary diseases, cardiac disease, orthopedic disease. We stuck people in bed. It was terrible. We created problems.
So what I hear you say is motion is lotion.
Motion is lotion. Move it or lose it. Move it or lose it is so much applies to cartilage. If you don't move it, you will lose it. Absolutely.
What is the cause of most people's hip replacements too? Is all that arthritic?
Again, it's genetic. It's genetic. So if you have women and men are in fact different with hip replacements. more than 50% of the women that I do hip replacements on are actually quite young. They're
Okay.
in their
Interesting.
50s and 60s. And it's because they have something called hip dysplasia. So if you have a purebred dog's hip dysplasia,
that's exactly what I was
bingo.
thinking
So
about,
happens
yes.
in humanoids
Okay.
as well. So for some reason, women are more likely to have a shallow socket, and therefore their hip wears out faster.
Okay.
Good news is we have a wonderful procedure called a replacement, which is a 1-month investment, and it's complete
wow.
release to full activity. Unlike a knee, which is much tougher to recover from, a hip is a walk in the park.
Why is the knee? Because I've heard that a number of times that knees are really tough to recover from.
They are tougher. There's no question. There's more work to recover. I believe it's just the mechanics of the joint. It's more superficial. It's near the surface. There's a certain amount of numbness around the incision that's inevitable. Just mechanically, it's a tougher joint to recover from once it's replaced. Still a very successful procedure.
I was just going to ask.
But it
okay.
really is much. So a hip is more work for us, but easier for the patient. A knee is less work for us, but much more for the patient to recover from.
Has the evolution of orthopedic surgery just been exponential in the time that you've practiced?
Yes.
How?
It's night and day.
Let's start at the very beginning.
I joined my dad in the early 80s. He was an orthopedic surgeon. And he was around with the development of hip replacement. So he worked with John Charnley, who was the father of hip replacement in England. And Charnley was about 5'6". My dad was 6'3", and it's an amazing picture to see these two. But anyway, so he was there at the beginning, and it took, you did 1 hip replacement a day.
Oh, wow.
It was
wow.
a 4 to 6 hour operation. You needed to transfuse usually 2 or 3 units of blood. Patients were kept at bed rest for 6 weeks after hip replacement, again, bed rest. Now a hip replacement takes less than an hour. We get our patients up the same day.
Do you really?
Absolutely. When they get up, they have no pain, 0 pain, because we know how to manage pain now. That's true for knees as well. So our folks are getting up same day as a knee replacement, same day as a hip replacement, walking 200 feet in the hospital, same day. If they're done in the morning, if they're done in the afternoon, it happens the next morning. But the point is, we manage pain better. We know how to do the operation better. The implants are better. So it's very different, very, very. It's different now than it was 9 years ago when I started working down here.
Is it really?
There's been change, yeah.
Symptomatically, what would I notice if I was getting ready to have a problem with my knee or my hip or elbow, head, shoulder, knees,
some
or toes?
people use the P word, pain, and it's pure pain, but there are other people that have very disabling arthritis that never use the P word. They say it's stiff. But it's lack of trust in your ability to get up out of a chair and walk to the bathroom, for instance. You feel like your leg's going to give way. So it's instability, stiffness, all related to the wearing of the cartilage.
When you're doing knee replacements, and I know this is a silly question, but are there areas that are more vulnerable to having problems in the knee?
Yes, so the knee is actually 3 separate compartments. The outside and the inside of the knee are almost in their own separate joint, and then under the kneecap. So women are more inclined to have kneecap arthritis. And therefore they say, when I do okay once I'm up and moving, but when I squat down to pick something off the floor, go downstairs, or get out of a low chair, can't sit through a movie without getting up and feeling like an old lady when I leave after sitting for 2 hours. So that's the kneecap joint. So there are different manifestations. Guys tend to have bowed legs as they develop arthritis. Gals tend to have knock knees as they develop arthritis. So there are patterns that are different for guys versus gals.
Here's what I'd love to do. Can we take a quick break and come back and maybe talk about, and excuse this word because I don't know what to say, some preventative kinds of things, functional things that can help me avoid coming to see you, heaven forbid. But on the flip side, talk a little bit about when we do need to come and see you, even if it's from a family history or genetic point of view.
Absolutely.
So stay with us. We'll be right back. Here
Thank you,
again with
guys.
Dr. Kirk Johnson. We're going to be talking about orthopedic surgery. Stay with us.